and TV Uganda, enlightenment on your hands always.
Busia district has received a TB X-ray machine reported that has artificial intelligence that will help in screening tuberculosis, TB, and other illnesses in the human chest. The Uganda shillings 200 million mobile X-ray machine was donated by the government of Uganda through Ministry of Health. Dr. Burua Aldo from Ministry of Health, who represented the Permanent Secretary, says during the handover ceremony of the machine at Masafu General Hospital that the machine will help in the screening of increasing cases of TB, which is reported in the country. The mobile X-ray machine can be taken to any health facility to offer service under management of the district hospital and district health authorities.
A big health problem. Each year, we expect about 100,000. That's on the higher side, but around 90,000 TB patients every year. That is, if you translate it to daily, we expect about 250 people diagnosed with TB each year. Each day. And also, TB remains a killer disease because we lose about 34 Ugandans every day due to TB. So it's a treatable, curable disease, but we do not find all the TB patients whom we expect, who can be part of the disease burden. So part of the reason why we are not finding all the TB patients is because the available technology that we are using is not effective enough to identify all the TB patients. Secondly, we also have challenges with the community in terms of health seeking. If they do not come to the facility, we are unable to find them. So now with the advent of new technologies like the X-ray, which we are commissioning, handing over to the district today, we now have ability to go and even look for the people who are still out there in the community. And I want to just relate this to the speech by the DHO, that this equipment its main purpose is to be used in the community. So the manufacturers try to make it as portable as possible so that it can be carried to the community, and we identify places where people could be at risk of TB and yet do not come to seek services in the hospital. We know such places in the communities, the drinking places. We have the landing sites where there are fishing communities. We have, for example, this being a border district, there's a lot of business that happens across the border.
Dr. Amoni Bwambale, the Masafu Hospital in charge, says that the donation has been timely.
I know the issue of an X-ray has been a very, very big thorn in our flesh. Every time we send our patients across Kenya, for X-rays. It has not been very desirable, really. But at last, we are sure that we shall give a service. If you see the number of people, even this morning, if you can know how many people send across Kenya to go and do an X-ray, it has not been very fine. But at last, we are grateful that we can receive an X-ray. I know this one is a smaller one, but we also have hopes that possibly the bigger one will be coming sooner.
Maybe a patient for an X-ray somewhere, and then it comes up that the patient is being denied service here. But also my staff, we should also not use that as an scapegoat to deny somebody service which this machine can provide.
So apart from this service of the TB, what other services do you need to be made?
We can use it on the abdomen. We can use it even on the limbs, but depending on how the patient has presented. Instead of this right now, I cannot give you a comprehensive list of what can be done.
Sikola Alopo, the Busia Deputy Kao, applauded Ministry of Health for considering Busia.
So we are banking on you to make sure that the uptake of HIV, TB services and the related ones, improves now in our district. Because since we have this machine, we should be able to perform better than where we are now. I think, Doctor, we should be able to track those indicators and see, with the machine now, are we moving up or we are falling or we are just in between, such that we are able to report accordingly. we badly need a lot of services in relation to this, especially issues of theater and also issues of radiology. Because now when they keep on moving this machine, it will break down because it will be overwhelmed, meaning we need at least additional machines.
Busia RDC Michael Kiwika and Stephen Mugeni-Wasike, the Busia LOC5 chairman, both warned medics over extorting funds from patients before offering to them TB X-ray machine services. They vowed to deal with whoever will be found guilty.
You people in the medical profession and the scientists, you are the only ones whose salary was increased. In some cases, tripled. Somebody who was getting 700,000 now is getting 2.1 million, among the lowest paid. It is very disheartening. After they have increased the salary, it is the time you are extorting money. All facilities here are free. Mr. MS, is that true or false? Nobody should pick money from anybody. And you health workers, if you pick money from anybody and you collide with us, because we shall arrest you. Mr. MS, even if it is you, if you extort money or you pick money from a patient in Masafu Hospital, we are going to arrest you.
Yes, we don't have them.
Is that this is illegal. It is illegal and totally unacceptable and shall not be entertained. Whether from who? When they introduced the team of people that have been trained, and this one was also introduced, I said, but this man had some scandals. And this is the one that has been deployed to take a charge of this. The scandals are not yet concluded, but now is now the big man here. The problem has now been transferred into now here. So guys, if you had some bad manners, mismanagement where you were when you are here, clean yourselves. Clean yourselves. Government institutions are being criticized a lot for extorting money from the public. That's the gospel truth. We don't want even to shy away from mentioning it. So MS, other than managing these human resource personnel, manage also their behaviors. Manage their behaviors. For us, you know, we do our things. The other time I was calling you, and I told you your doctor has picked money for an operation close to 800. That money was refunded. Thank you for your intervention. For me, I am now graduating. You say every year you graduate. Instead of making people pay back, now I go now use the mechanical methods. Because the other one, it means people are not understanding the what? The language. But why do we go to that far? Let us understand the purpose of government. Government says we want to bring services near our people. Free services.
User training. You bring this without a service guide, without a manufacturer's guide, without a user's guide. Within only 1 minute, they will be done. And so we need physically so that people appreciate this.
200 million shillings.
We have not yet done the training orientation of the staff.
So they are the same.
We are going to arrange it. Reducing the other side. If you see, you are just reminding, read out. So in other images, you will see less of this. If they are this, it's going to be lower. Even in 40, you can still have some. But this one here.
So what's here? That's your stomach.
That's
there in the stomach.
Now we don't have the printer, but the image can be shared by email to the smartphone, or you take a photo.
Okay.
From there. Yeah, and then send by WhatsApp.
Digital.